Hello, I'm Carolyn McClanahan. I'm a physician and a financial planner. I speak nationally on the intersections of health and personal finance, including healthcare reform. In 2010, I read the entire Affordable Care Act and started speaking around the country about what's in the Affordable Care Act, and since then, I've kept financial planners and their clients up to date on what's going on with healthcare reform. I recently put together a talk on an update of healthcare reform, including the history of healthcare reform throughout the past century and the cost of our healthcare system, what happened to the Affordable Care Act, the American Health Care Act, and what's currently going on in the Senate. Finally, I talk about other options for how we can fix our healthcare system. This talk has been very popular, and I've been asked to put it out on YouTube so that the general public can see this information. So I'm going to do a number of short videos for you to watch and break them down into sections. The first is going to be the history of healthcare reform. Truman attempted health reform in his first 2 years in office, but he couldn't get it together. The biggest opposition was the VA health system. The veterans got great health care, and they were worried that health care reform would actually ruin their health care. That's very interesting considering how the VA has delivered care on and off throughout the years, and currently right now people aren't very happy with the VA system. The AMA, American Medical Association, was also very resistant about health reform. They did not want politicians getting between them and their patients. About half the country had private health insurance at that point. And Truman sent a bill to Congress, but he couldn't find a method to finance it. Then the Korean War happened, but the good news is the bill that would eventually become Medicare in the Johnson administration was written. This shows that it takes a long time for health care reform to percolate. Eisenhower, he pushed private insurance, but he attempted reform through high-risk reinsurance, kind of like what the Republicans are doing today. He was very focused on budgets and deficits, but at that time, 9% of the elderly, single elderly, and 14% of elderly couples had insurance that covered medical expenses, so that was very few, and a lot of elderly people were suffering. There was the Care-Mills bill, which provided a stipend for the poor elderly to buy private health insurance. It only helped about 1% of the elderly. This is another Republican proposal that's been floated throughout the years of how to help people buy health insurance. The one big thing that happened during the Eisenhower administration is there was a tax exemption created for workplace health insurance, which is why we have insurance tied to employment today. Back during World War II and after World War II, there were a lot of wage and price controls, and so the way that employers enticed people to come work for them was to provide health insurance. So once that was considered a tax exemption, it has been very, very difficult to get anybody to think outside the box of removing health insurance from employment, and that's why it is like it is today. So Kennedy, he was way more interested in international affairs. He presented Medicare but didn't push it at first because it was a very tight election and he really didn't have legislative backing. He finally presented it, but it was voted down 52-48 because somebody bought off a senator. And then, of course, we know that Kennedy was assassinated, and Johnson came in. He had a huge mandate, was elected by a landslide, had both the House and the Senate, so he had a lot of momentum behind him. And he ended up becoming the most important healthcare president ever. It was very funny because there were three competing bills floating around: a Democratic Party to pay party plan to pay the hospitals. The GOP had a plan to pay physicians, and the AMA had a plan to take care of the poor. And President Johnson was such a legislative master that he was able to finagle it and said to the people pushing the bill through, just pass all three bills at once. He didn't give a damn what it cost, and that's exactly what he said. He was a very imposing man. So that is why we have Medicare A today, which pays for hospital costs, Medicare B, which pays physician costs, and Medicaid, which helps the poor. Then we have Nixon. Now we have older people taken care of, and we had poor people taken care of, but everybody else wasn't taken care of unless you were employed. And so he wanted a comprehensive health insurance plan. He put forth CHIP, that's what it was called. It required all employers to provide coverage. It limited employee cost sharing. It provided generous essential benefits. And the government provided coverage for those not employed. So that would be called what is a public option. This is very fascinating because if you look at this, it's very similar to what the Affordable Care Act is today. In fact, the Affordable Care Act originally had a public option, but that was voted out, and so I think that is a shame, though, because it's great to have public-private competition. And so now we only have private insurers providing insurance through the Affordable Care Act, not a public option. Now, Nixon's plan would have passed, except we all know what happened, Watergate. So health care reform, again, got put on ice. So President Ford did basically nothing about health care. Carter was very much into welfare reform instead of health care reform. Reagan was against socialized medicine, but then he, at the end of his term, proceeded to over the largest expansion of Medicare since Medicare was enacted. And we'll see in the next video what that actually did to health care costs. Now, President Bush, the first one, he offered tax credits for low-income individuals to buy health insurance. But he wanted to finance that by taking away the deduction from employer coverage, and that was a no-go, so it failed. Clinton, he tackled reform early in his term. I mean, that was a big deal, and he failed because he really didn't know the ropes. He didn't involve enough people, and it went nowhere, and that caused such a huge negative thing for the Clinton administration that they did not tackle anything with health reform the rest of his tenure. Now, Bush number 2, another fascinating thing. He, at the beginning of his term, he did the second biggest expansion of Medicare ever, Medicare D, which paid for prescriptions drugs. It was called the Medicare Modernization Act. And of course we know President Obama did the Affordable Care Act. So that's the history of healthcare reform. Our next video is going to be the cost of healthcare. So I hope you stay tuned and keep watching.